there's really not a ton of space on that campus. There's, in addition to this plan, there's 2 other parcels that we can use. You're aware of the growth of the community. You're aware, we've made you aware of the medical needs of the community, hopefully. We anticipate that entire campus is going to be needed to be used for medical use. We knew that. We engaged KinderCare several years back about a new location for the daycare center.
Okay, thank you. And the reason I say this, and the reason I ask these questions, Madam Mayor, is to demonstrate, both the intention of Mary Washington Healthcare, but also to kind of point out for the public the limitations that we have on City Council to dictate the tenant of any particular property, and the private agreements between 2 parties, in this case KinderCare and Mary Washington Healthcare. I am incredibly sympathetic to every parent who has had this rush of fear surrounding where you're going to provide childcare. I agree wholeheartedly that childcare, the lack of childcare, is one of the most gripping problems that we have in this country, both from an economic development perspective, but also just from a family structure perspective. Being able to provide childcare is foundational, and not being able to do that provides so many second and third order effects. I don't even have the time to list them tonight. Unfortunately, from the City Council's point of view, or at least from our prerogative, we lack the authority to mandate KinderCare's presence continually at Mary Washington Healthcare. It is on us to review only the zoning application that comes before us, and whether or not that zoning application is appropriate for the uses as intended. As we've heard tonight, the intent was for KinderCare to eventually vacate those premises, regardless of whether we approve this rezoning or not. And if we look only at the zoning, taking out the KinderCare aspect, which unfortunately we do have to do as a City Council, and recognizing that KinderCare was not going to be there long term, regardless of what any of us wanted, this is a necessary step forward in the expansion of healthcare in our region that is so desperately needed. I will be supporting this. It is unfortunate what is happening with KinderCare. That is unfortunately outside of our control, and I do hope that the KinderCare executives can find a much closer location than 5 miles out, and try to keep something within the 22401 zip code. I share my colleagues' disappointment that KinderCare has not been more public, has not been here tonight, did not attend any of our work sessions on this matter. It is unfortunate that they have not been as transparent of partners as I think many of us would have liked. But that is unfortunately the situation we face today. But I will be supporting this, Madam Mayor. Thank you.
Thank you. Mr. McIntosh?
Thank you, Madam Mayor. I just want to say that this is a tough situation here, where it's sort of like having to choose between 2 of your children, which one is the favorite, right? By which I mean these are 2 very real needs in our city, right? Healthcare and childcare. And I agree with Councilor Graham, right, that this is ultimately a land use decision on a campus that is owned and managed by Mary Washington Healthcare for the purposes of healthcare, and that we have to defer to the private market here in terms of what they consider to be the highest and best use of their facility. But I would like to say, I'd like to take this opportunity to perhaps challenge my colleagues on council and perhaps the staff to see if there are if we can look into if there are any tools that we have in our toolkit to encourage the development of childcare facilities as well in the city. I don't know if there are some zoning changes that we can undertake, or incentive programs or something like that, to make sure that we aren't having to choose between which of our children are the favorite here, right? That we can support this incredibly important expansion of healthcare and of medical education in our city, but also look for ways that we can make sure that we are, over the short, medium, and long term, meeting the childcare needs of our citizens too. So let's take this opportunity, right, this choice that we're having to make here, to say let's make sure that we don't let that other problem slip by the wayside here too.
Vice Mayor Fry.
Thank you, Mayor Devine. To Councilor McIntosh's point, I'm in from the extension of the conversation. I'm definitely in support of that being a work session item for the future for us to discuss. About what the future holds for child care in the city of Fredericksburg. And I guess I'll pass it over to the Mr. City Manager to help organize the thought from Council McIntosh. But good point. That's our job to approach every issue. So I'm glad that you brought it up, that way. And considering this is dedicated to a request for zoning, the social issues and the real issues that we have to deal with is our responsibility to address. And we just don't know how those issues hit the table or when they hit the table. So, that's our job, and we are, definitely considerate to the concern. So, yeah, but I'm in support of what you said.